The World Health Organization is in a midlife crisis. Some less charitable than I would say that it's incipient death throes. It's hundreds of millions of dollars short of what it needs. It doesn't seem to be able to deal with the global health crises, its primary responsibility. The leadership is largely ineffective, and the complexity of the architecture of the World Health Organization is deeply distressing because you don't even know how to manage it. Let me look at those various components because we really are in a critical moment. The World Health Organization is hundreds of millions of dollars short because since 2011, contributors who are worried about WHO's credibility have been giving reduced funding. So the funding is now dominated by the United States and the Bill Gates Foundation. In other words, WHO is firmly in the hands of the Americans. Now, the priorities and strategies of Bill Gates with its earmarked money doesn't always equal the priorities that the world thinks should be in place. So somehow we have to take it away from William Gates and do something about the funding, which has reached calamitous proportions. Secondly, the global health crises. As you've noticed, the World Health Organization was abysmal when it responded to Ebola, and although it has declared an emergency around the Zika virus, they came to it rather late. In fact, the Latin American component or division of the World Health Organization declared a state of emergency in Brazil several months before the World Health Organization headquarters in Geneva. You see, the lag time is simply not credible. And then the leadership. That's always uncomfortable, isn't it, to be critical of the leadership? And I don't doubt that Dr. Margaret Chan is a perfectly decent, lovely human being, but she lacks capacity to direct the organization, and everyone knows it. They're now looking for a new director general, and that person has to have vision and focus and energy, maybe even the occasional charismatic flamboyance. It wouldn't hurt if it can pull WHO together. And finally, the architecture. There isn't really one WHO in Geneva, there are 7 WHOs. The World Health Organization has regional sections all around the world, and they act independent of each other, and they're a law unto themselves. So, for example, in the case of Africa, for a number of years, until very recently, you had a head of the World Health Organization in Africa who, if not corrupt, was hopelessly manipulative and destructive. Witness what happened in West Africa around Ebola. You see, we have to come to grips with WHO. And the executive board meetings understand that because the criticism is rising. And they best find an excellent director general. They are at the moment on life support. And there has to be a therapeutic answer. That was last week. I'm Stephen Lewis.